Good evening, class. My name is Jemhad Omune, and I'm going to take you through drug management cycle. You are welcome. Drug management cycle involves four basic functions. Function number one is selection. Number two is procurement. Number three is distribution. And finally, use. Selection involves reviewing the prevalent health problems, identifying treatment of choice, choosing individual drugs and dosage forms, and deciding which drugs will be available at each level of healthcare. The second one, which is procurement, this one includes quantifying drug requirements, managing tenders, establishing contract terms, drug quality assurance, and ensuring adherence to the contract terms. The third one is distribution, which includes clearing customs, stock control, store management, and delivery to drug depots and health facilities. And finally, the use, which includes diagnosis, prescription, dispensing, proper consumptions by patients. At the center of drug management cycle is a core of management support system, which include organization, financing and sustainability, information management, human resource management. Finally, the entire cycle rests on a policy and legal framework that establishes and supports the public commitment to essential drug supply. The figure below shows the drug management cycle. We have the procurement over here. Here is the distribution. We have the selection, and finally the use. Let us take a look at some of the challenges faced during drug management and how these challenges can be improved. Number one challenge is achieving financial sustainability. Financial sustainability is achieved only when expenditure and financial resources balance and are sufficient to support a given level of demand. To achieve financial sustainability, policymakers and essential drug managers must become familiar with economic concepts and methods related to cost containment, efficiency, cost-effective analysis, public expenditure decision, the role of public and private sectors, and the economics of regulation. The second one is by improving efficiency in public drug supply. The effectiveness of drug supply system in achieving a reliable supply of essential drugs must be continually and objectively assessed. Selection, procurement, and distribution can each be carried out in a centralized, partially decentralized, and fully decentralized systems. The third one is by changing the perception and behavior of providers, patients, and public. One of the greatest challenges is to change the way in which providers, patients, and public view the use of pharmaceuticals. Major problems noted earlier include prescribing and incorrect dispensing, harmful or unnecessary drugs, failure by patients to use needed medication correctly, and wasteful or harmful self-medication process. Given the share of public and private drug expenditures that can be wasted through irritational drug use, it is essential that government, NGOs, and others continue to explore effective and sustainable way of improving drug patterns. The fourth one is by regulating safety, efficacy, and quality. Regulatory controls, often neglected in the pharmaceutical sector, is an indispensable foundation for ensuring the safety, efficacy, and quality of drugs in a country. Drug legislation and regulation establish basic professional standards in both the public and private sector. The fifth one is by reorienting the role of the government. Access to healthcare, including essential drugs, is a fundamental human right. From a public health perspective, therefore, the main concern with the private pharmaceutical market are availability, affordability, and rational use of drugs. Measures to improve availability include certification and training of pharmacy aides and other drug sellers, licensing provision and incentive for all wholesalers, pharmacies, and other drug outlets, dispensing by doctors and clinicians in selected areas, and community drug schemes. Affordability can be improved with greater insurance cover, better price for information, and price competition through generic substitution, regulation of producer prices, and modification of retail sale margins. Thank you so much, class. That's the end of our lesson today.